Hello everyone, today we are going to learn about blood pumps. First of all, what is the purpose of blood pumps in cardiopulmonary bypass? It is to replace the beating heart during heart surgery. They propel blood and other physiologic fluids throughout the extracorporeal circuit, which includes the patient's natural circulation as well as the artificial one. What does an ideal blood pump should have? It should be able to move large volume of blood up to 7 liters per minute. It also should minimize the flow velocity so the blood damage will be minimized. The pump components in contact with blood shouldn't damage the blood cells and should not activate coagulation cascades. The design should be simple and free from dead spaces and recesses to avoid stagnation. Calibration of pump should be easy, reliable and reproducible. Pump should be automatically controlled for routine uses but should be designed for possible manual operation in case of power failure. The roller pumps. The twin roller pump has now become standard. It works on the principle it has two rollers placed opposite to each other. Each roll the blood through the piece of a tubing. When the rollers completely occlude the tubing, the pump generates both positive and negative pressures and so can also be used for suction. Roller pump includes two rollers positioned on a rotating arm which compresses a length of tubing to produce forward flow. This action can produce hemolysis and tubing debris, the incidence of which increases with time. Hence, the use of roller pumps for longer procedure is discouraged. Here is an image of a roller pump. Tubings used in roller pumps. Most pumps use tubings made of silicon or polyvinyl chloride. That disposable tubing used in the pump head of roller pump is the only part in contact with the blood. The internal diameter of the tubing is major determinant of the maximum blood flow that can be achieved. Spallation. The mechanical stress caused by the repeated compressions of rollers on the tubing cause material fatigue and generate microparticles. Occlusion settings. A key issue for controlling the output, tubing wear, and blood damage in roller pump is the occlusion setting of the rollers. Three possibilities: under occlusive, over occlusive, or occlusive. Occlusion change over time, causing reduced wall thickness of tubing and temperature changes. The easiest method is to fill the outflow tube with the fluid and hold it in a vertical position while adjusting the occlusion mechanism until no fall in level of liquid column is observed. Non-occlusive roller pumps. The MC3 pump is a passive filling peristaltic pump that combines many advantages of both centrifugal and roller pump. This pump is non-occlusive and should be used as all non-occlusive pumps in combination with a flow meter. It consists of a completely flat pump chamber that is wrapped up under tension around rollers. The rollers are mounted on a rotor. Rotation of the rotor imparts a peristaltic motion to the blood within the pumping chamber. When the inlet of the chamber is supplied with the blood at a pressure above ambient, blood is moved toward the outlet. Benefits of non-occlusive pumps. This pumping concept offers some unique space safety benefits. Air cannot be pumped because the pump needs a preload which is only present with fluid in the reservoir. The natural flat shape of the pump chamber allows for a total collapse, thereby preventing retrograde flow when the pump is stopped. The fact that the pump cannot generate negative pressure will attenuate blood damage and reduce microbubble generation. The non-occlusive nature of the pump will prevent failure of tubing connections. Rotatory pumps. Rotatory pumps have three basic designs: axial, diagonal, radial. Radial is centrifugal pumps. In diagonal and radial pumps, a disposable housing is coupled magnetically with an electric motor, making these designs more suitable for routine CPV. Together with the roller pump, the centrifugal pump is the most used pump for routine CPV. Centrifugal pumps, its working principle. Centrifugal pumps operate on the principle of moving fluid by creating a pressure gradient between the inlet and the outlet of the pump. Centrifugal pump consists of impellers stacked cones within housing. When rotated rapidly, negative pressure is created at one inlet and a positive pressure at the other, thus propelling the blood forward. They are afterload dependent, so if the patient's systemic vascular resistance increases, the cardiac output generated will drop unless the flow through the pump is increased. Centrifugal pumps may improve platelet preservation, renal function, and neurological outcomes in longer cases. Here is a chart that depicts the differences between the roller and centrifugal pumps. So usually roller pumps are afterload dependent, centrifugal is afterload dependent. No flow meter required for roller. Centrifugal requires flow meter. There will be increase in blood trauma and tubing debris in roller pump. There will be no black backflow. It is cheap. It is used for short term use. It is bulky. Circuit disruption from excessive line pressure can occur. Greater risk of air embolism, and also priming volume is lesser in lower pumps. And in centrifugal pumps, retrograde flow is possible if pump stops. It is expensive. It is good for long term use. It is portable. There will be no disruption. Lesser risk of air embolism. Priming volume will be more. Flow meters. Flow meters are indispensable parts of centrifugal pumps. There are two types. One is working with an ultrasonic principle, the other with an electromagnetic principle.